We talked a lot about the Neutrogena gel cleanser, which has that amazing polymeric technology based on
Yep.
potato starch, where you can think of a polymer that kind of lassos the different surfactants and keeps them all in check, so they can't sneak off and do nefarious things like impair the barrier. So
Exactly.
we love that gel cleanser because it's foaming, which meets patients' needs and
Right.
desires, but it also helps to make sure that we clean the skin but not impair the barrier, as I said. And then we've got the Neutrogena Hydro Boost moisturizers, right? We've got the water cream and the gel cream. The difference being the water cream's a little bit thicker. It's got the
Yep.
natural moisturizing factor ingredients as well as lipids that help to replace that which is lost in an impaired barrier. And the
Yes.
gel cream being a little bit lighter. And those two, along with and you mentioned this in one of your episodes, Patty, just the incredible selection of Neutrogena sunscreens. I mean, if you don't,
Unbelievable.
if you can't find something that you like in that selection, I'm not sure you're ever going to find a
You're in
sunscreen you
trouble.
like. Yeah.
You're in trouble. No, you're right. And we did talk about that, especially in the teen episode. And, we talked also about the preteens, and getting kids to use sunscreen is hard. And they've just got about every formulation possible, sticks and sprays and lots of really great creamy formulations, daily use sunscreens, beach sunscreens. They're just in every part of that particular category of skincare products. And as I mentioned in one of the episodes, there's a lot of companies, especially the smaller ones, that really don't play in the sunscreen arena because it's not an easy one to be in. You got to be in it to win it with sunscreens. You got to really have somebody who's
Yeah.
a great formulator who really understands the nuances of that. And I mentioned Joshua Williams, who I had interviewed, who works with the Neutrogena team and does a lot of the formulation. He was just a wealth of information. So you can see how they get the breadth of products that they have to offer consumers. It's really impressive.
I liked what Dr. Benjamin said, and it was something that I'm going to take back into my practice, which is, the mom can control the sunscreen on the body, but the kid really should control the sunscreen on the face. And she liked the sprays for the body because they were quick, easy, and you can rub them
Mm-hmm.
in. But let the kid have the stick and apply the stick, him or herself, and have ownership and autonomy on that. And I really like that idea. I've never thought of it that way. But that's going to change how I practice. So I appreciated that, Pearl.
I liked it too. I thought she had a lot of great practical advice as well. We talked a lot
Well,
about acne in that series as well. And
mhm,
I think there was some really good tips about that. We talked about using acne patches and how great they are because they stop kids from picking. So you
mhm.
don't get that acne excoriae and you don't have all the post-inflammatory hyperpigmentation and the prolonged healing. So they're not just cool, which they're now cool. And I love that, but they also did some nice studies and talked to kids who were using them, and they said they were picking their face less and their lesions seemed to go away quicker. So, that's a really nice addition for this particular age group.
Yeah, I think that dermatologists probably don't pay enough attention to patches, quite frankly, because we kind of poo-poo them. Most of them are just hydrocolloid
They
and
are
maybe not do a lot besides provide a barrier and help protect the skin barrier as well. But we have to meet the patients where they are, right? We have to educate them
100%.
and allow them
100%.
to use what they want to use for them to feel ownership over their own skincare routine. And I think that the patches really allow our patients to do that. And thank goodness we have so many different options, some medicated, which I'm not a huge fan of, but the other ones that are not medicated and really just a hydrocolloid are fine.
Yeah.
And people love to use those.
Yeah,
So
they do. And
let
I
them
think
use them.
I think we're getting greater acceptance with the consumers for them. And I think the dermatologists are now starting to rally behind them as well. And then we talked a little bit about Neutrogena oil-free acne wash because that's such like a gold standard in dermatology. It's such a nice, non-irritating product. And they did a nice little study where they looked at patients with acne who used nothing but that product, didn't have any other topicals, and their acne did get better over the time course of the study. So just using a good cleanser that doesn't irritate, doesn't disrupt the barrier. And they had done some preclinical work as well, but just it's a nice product to remember.